Awesome. Let me just interrupt you ladies right quick. You're listening to Dr. Tiffany Gray from Dr. Gray Health and Susan Joseph from HealthTrends.ai. We have two quick questions from the audience for you, Susan, before we wrap up here. The first question is, what will or is Health Trends' first product?
Our first product will be an index. We're putting together the parameters around the index, dealing with the particular health statistics and the other statistics that we want to add in. That index will be available. That is one of the products that we will release with Chainlink.
And just to give the audience a little bit more context, can you tell us what will a state or government entity do with your index?
I don't know if the state or government entity will do anything with it, but I'm sure that private enterprise will do something with it because it's going to have economic factors in it. It may be that the state uses it as well, but I've anticipated that it's a private entity tool.
Mm-hmm. And so again, the questions are coming in. How will a private entity use Health Trends Index?
So imagine that you could have had an index. Okay, I actually interviewed a number of asset managers during the period of time when I was thinking about how to structure the products. And the products, we're a young company, the products are evolving. But one of the things they wanted right then and there was, do you have an index that can tell me what's going to happen or that I can use to predict for business openings, business shutdowns, so I can use for my investments, for my restaurants, my entertainment, my supply chain, my transportation, et cetera. And, I was told some of the best minds were building these things. I mean, I talked to product companies, I talked to asset managers, I talked to insurers. They didn't have it built. They still don't have it built. So I think that that's something that we can use, because if we could have answered that question, then we could have sold a bunch of services. People were looking for that answer, and they kind of just threw their hands up and said, we don't have it. We're going to make the best guess. We hope it's right. We'll let you know in 6 months, 8 months how it worked out.
Yeah, I see where HealthTrends.ai will take some of the guesswork out of that. Which is super important. And so I want to move on very quickly to our next question. You mentioned vaping and cannabis. I believe Dr. Gray has some expertise around cannabis. So can you explain how Health Trends solutions could potentially help in the vaping or cannabis industry?
Sure. So it's a matter of gathering the statistics. Again, I went on to look to see, as we see the various states legalizing cannabis in different stages, they're going to collect statistics, one for taxes, and they're going to collect them for other reasons, for public health reasons. I've looked to see who has dashboards on this regarding the states, and I've only found one state with a dashboard. Very reminiscent of what happened at the beginning of coronavirus. Not that I'm saying cannabis would be a plague, because I don't think that at all. But, when we first started with coronavirus, there were 0 dashboards. There was some media reports that you could go pick numbers off, or an announcement, or that was it. The dashboards didn't exist the way that they do today. So similarly, I would imagine that states are going to be tasked with tracking numbers and are going to struggle with how they're going to put it out there. So that could be, or, to make it easily accessible. They will have to put it out there, but making it easily accessible is not going to be their priority, because they simply aren't funded to do that.
Mm-hmm. And so hypothetically, Dr. Ray, as we wrap up here, I know your time is precious. You have some expertise with smoking cessation, perhaps vaping, as well as cannabis. Hypothetically, can you see an application for Health Trends in the vaping or cannabis reporting space?
Potentially. I think it would, in terms of sharing of information and data within the tobacco control space, we have several survey tools that are, collected, everything from the youth risk behavioral survey to adult tobacco survey. It would be very important in the space of, for example, with our quit lines, so the national quit lines and the various vendors that collect that information. To see, for example, how many people are either switching over using ENDS products to, quit smoking, or what types of other nicotine replacement therapies that they're using, looking across co-use or, poly tobacco use, or, multiple use of various products, and use with other substances. So much like, for example, as many states are really, honing in on addressing issues of opioid abuse. So I think that there is, an opportunity for being able to share that information, especially within tobacco control research. There's so much academic research that's being conducted, pretty rapidly. It can help to, inform other researchers or other institutions that are really honing in on trying to develop media campaigns, or, trying to identify the best approaches for addressing these issues. So there's definitely a, potential for HealthTrends to be very useful within the tobacco control space, as well as within the cannabis industry space as well. And I see that when we talk about other businesses, especially if I think on the other side of the aisle, so those who are pro ENDS use, pro vaping, pro cannabis use, many people will be looking to use that information to constantly inform policy, or to, whether you're against it or you're for it. But businesses are always trying to, identify ways to see that this is being useful. But it's also important. And of course, there's always room for, while HealthTrends can be great for showing the data for what it is, it's still going to be a challenge where you have people who can take numbers and make it fit their story. But again, it could be very useful within, the public health space or the public health prevention space for tobacco and cannabis use.
Awesome. So thank you all for tuning in and listening to Dr. Tiffany Gray from Dr. Gray Health, and Susan Joseph, from CEO and founder of HealthTrends.ai, as we talked about the latest and greatest for health trends. For more information on health trends, visit them online at www.healthtrends.ai, and we will see you in the future.